and it undermines who we are, and it may be good for their profits, but that's what counts for them. It's not what counts for us in the census. Sadly, we have more concern about moving on to the coronavirus. We have more concerns about additional awareness, anyway, of the spread of it. I don't know if these are additional cases or we're just learning more about what is out there, and some loss of life. It's very sad. But we really have to, we're very proud that yesterday we came to the floor, had a very strong bipartisan piece of legislation, much improved on what that was sent to us originally in terms of the appropriation of the coronavirus. And but again, except for three, I think it was only three who voted against it, strong bipartisan support, which shortly will be voted upon in the Senate, sent over. We'll have a signing ceremony, send it over to the president. But as we go forward, we have to just stipulate to fact. We have to dispel some of the misinformation that has been put out there. And for that purpose, we've had the opportunity in a number of meetings, yesterday with the vice president, today with a wide range of representatives of the administration, to just try to correct the record. When the president says there are only 15 and there are 4 or 5 times that many at that time, there are more now, that's just not right. And when the president said go to work, no, there are other guidances that should be out there. And when the president said, and he did say, precisely, the Obama administration made a decision on testing that turned out to be very detrimental to what we're doing. He said that Wednesday at a meeting addressing the virus, the outbreak. And we did that decision a few days ago so that the testing can take place in a much more rapid and accurate fashion. Well, the aide to Senator Lamar Alexander, who was the chair of the Committee of Jurisdiction, said the administration, the Obama administration, made no such rule change. And a policy expert at the Association of Public Health Laboratories said that we aren't sure what rule he was referencing. There was intense interest in doing some things, but that, he agreed with Mr. Chairman's aide's statement that there was no such rule change. So again, we go down this list of things. Now we're trying to, at our briefing yesterday, we're honored to have the Vice President visit as the representative of the President in terms of fighting this virus. We had concerns, and they're going to get back to us on some of the answers. The concerns regarded not only the number of the test, but the integrity of the test, and having to correct tests that were not reliable before. Next on that is when you take the test, then it has to go someplace to be analyzed, and what is the turnaround time, and are people walking the streets not knowing whether they are positive or negative, and we need to ramp that up so that that shortens the time between the test and the judgment as to whether it's positive or negative. We also have concerns about travel. We're getting some that said use common sense when you travel. We have others who are more specific in what they're recommending, and they're going to get back to that on us. We have concerns about the workplace. Do people get unemployment insurance if they are told to stay home from work, or if their business shuts down, sadly, then how are they compensated? How do they live under those circumstances? So we want them to get back to us on that. We were pleased that in our bill we were able to get the SBA loans approved that would go to businesses that are negatively impacted, small businesses that were negatively impacted. Now let's just say, in terms of fact, what the proposal was that was sent to us was $2.5 billion, some of which was ransacking the Ebola account and the home heating account for poor people, the LIHEAP account, those kinds of accounts. Instead, what we passed yesterday was $8.3 billion of new funds, not ransacking anything, and designated specifically for the purpose as spelled out in the legislation, addressing some of the concerns we have about testing, about analysis, processing of it, getting the information there. Other questions that came up at our meeting with the Vice President yesterday regarded healthcare providers and their exposure and how we protect them, whether it's with advisories or whether it's with masks or whatever physical possibilities there are. And they're more than just the masks, so gowns, whatever. So it's sad. Hopefully this is all redundant. Hopefully that we are taking precautions that will prevent more from happening, but that it's a giant step forward. We think we need to do more depending on how this expands. But we don't, we want to have what we need to have because we want to have the people to have confidence. And I think one important way to have confidence is first to have truth and trust in what is being said, to have the resources necessary in real time that compensate state and local government and other entities that are already spending resources, using beds, accommodations, having an opportunity cost for what else they might be doing with those. And again, working together in a completely apolitical way on this, based on science and evidence and fact and truth and the true epidemiology of this coronavirus and where it exists and how it spreads, and again, how America can be a resource to the world because, as you know, these viruses know no boundary. And so in a humanitarian way, as we did with Ebola, we want to help to stop it and prevent it. But it also is in our interest to do so. So that on those two. And next week we have a number of bills coming up, repealing the no ban, the Muslim no ban issues that relate to, later we'll be doing the surprise billing, but hopefully very soon on that. We're coming to closure on bipartisan proposal in that regard. But next week we hope to reauthorize FISA, and we plan to pass Senator Kane's bipartisan war powers resolution, among other things that we'll do next week. So again, though, everything is overwhelmed by the coronavirus because this is about the health and well-being of the American people and how we, in a very coordinated, government-wide way, respond to it. And as I say, we're proud of the bipartisan nature of the bill that we were able to negotiate yesterday. It took some time to add Small Business Administration as members came in with ideas. I'm very proud of California, Mike Thompson, and others from rural areas talked about telemedicine, telehealth, and that we're able, after much negotiation, to finally get that into the legislation as well. So we're listening to members and trying to accommodate their experience and what can be helpful from that experience in the legislation. So it was good, and I'll look forward to signing the enrolling the bill before we send it to the president later this afternoon.
Madam Speaker?
Yes, ma'am.
Chuck Schumer said that Neil Gorsuch and Brett Kavanaugh would, quote, pay the price for voting against abortion rights. Were those comments appropriate in your
Well, I believe he also said on the floor today that his words were not appropriate, and I support him in that. It's unfortunate because, as you see, I think the Republicans say it's okay if the president does it, but it's not okay if other people do it. It wasn't right for anybody to do it, and Chuck recognized those words. Yes, Nancy?
Madam Speaker, do you feel you have gotten a full explanation at this point for why the U.S. was so much slower to get test kits out the door than some other countries?
Well, let's just say right now in China, I've been told by some people that in China they are saying that this all started in the United States. Well, we know that it did not. But we do know that when it started in China, there was a delay in informing the Chinese and the world as to what was happening. At the same time, the president would say, heck of a job, President Xi. You know, he's making that he was such a great leader, was going to take care of this as soon as the weather warmed up. But I think that part of the problem was lack of notice in a timely, responsible, scientific fashion as to what was existing. Then our exposure to it, we weren't ready in terms of the advisories that were being put forth by the CDC, saying you only test somebody if they just had a trip to China or if they're old and have diabetes or something like that. Well, that was not the appropriate guidance. They know that they had to correct that. So let's talk about the future. Let's say there were that many of the tests were not good enough. The analysis is still, in some cases, taking too long, but was not in appropriate time fashion to let people know you should go quarantine or you should go to work, and the list goes on. But what we think we can do in this bill is to correct a great deal of that, and then to go forward. Now, again, we can go through a whole list of things that in 2018, the president shut down the office, the part of the National Security Council that deals with this issue, just shut it down, never appointed other people in the role. In his budget, he cut out $700 million for CDC. When they asked, he said, I just don't like having a lot of employees around. When we need them, we'll get them back. Well, no, they are doing a job, and we have to recognize the value of their worth and have them trust the fact that they will not be here today, gone tomorrow, and don't get another job because we may hire you back later. So I think there were some mistakes that were made, but not so much to dwell on them, but to go into the future and say, we can't do that. The people who are there in the Obama administration, in the National Security Council and related agencies who were there for this particular purpose. Quite frankly, if you want to see a template about how to deal with such an epidemic as Ebola, look to what the Obama administration did. It was picture perfect. It was really excellent in terms of how to husband and allocate resources, also talent, to put some of our scientists in a place where we could really evaluate what the epidemiologies, what are the prospects for more people catching it, what can we do about that. We didn't, that much of that was erased in the Trump administration. I think the reality of this, even if the president thinks it's 15 when it's 65 or whatever it was that day, I think the reality is in the public domain, thanks to many of you, and hopefully some of the people in the Trump administration. So right now, it's about how we go forward, recognizing that we were on a path that wasn't working, but not blaming it on somebody else, but taking responsibility for it now.
Are you interested in investigating what went wrong?
We just want to get people well. We just right now want to make sure that this does not spread, and that people get well. As we go forward from this, though, we should have after-action review and say how can we be better poised for how we go forward. But this is we have simply no idea of how much this may spread. So our focus has to be on stopping the spread. And curing people. And so that means we also have to invest, as we do very heavily in our bill, in a vaccine to help prevent, but that takes time. Also in the pharmaceuticals the therapies that will help and possibly cure. One thing we did in the bill was to try to ensure we're 100% successful, that the prices that were charged by the private sector for any vaccine or other therapies would be reasonable and fair. That is how the federal government contracts, reasonable and fair, and not have an exploitation by the private sector of the taxpayer or of the patients. We were only able to succeed with that in the public sector piece of the bill. We fought till the end to get it in the private sector so that people with insurance and the rest would not be subjected to any price gouging. Hopefully they won't be, but we wanted to ensure that they wouldn't be. So again, there's the research that goes into the vaccine, the rest, you have to make sure you have the resources so that you can, with certainty, continue the research, keep the people employed who are doing that great work. And when we rein this in, and hopefully that will be soon, but who knows, then we can do an after-action review as to what we need to be fully prepared, because it is an insurance policy. And insurance is something you have in case you need it. But it isn't something you have because you know you're going to need it, because nobody would be in the insurance business. Yes,
Madam Speaker,
yeah.
good afternoon.
Yeah.
What are your concerns about the threat in this building? I know you met with the other congressional leaders yesterday about congressional operations. This is a very different work environment. People come to visit the Capitol. There are constituents coming and going. What do you see as the potential here, and how that could impact congressional operations if this got worse?
We are a place where many people come, especially at this time of the year in the spring. So what we want to do is to make sure that our visitors, our press, our staff, and our members take the precautions necessary, or in their own lives for wherever they do live, but especially when they come to a place like this where many people come together. So some of what we were briefed on yesterday is on a classified nature, some not, and some of it is just about good hygiene and washing down your tabletop and washing your hands for 20 minutes and sneezing into a tissue and throwing it away, that kind of thing. But that is part of the briefing that we received from the Capitol Physician's Office. But from the Capitol Police, we were assured about initiative, and I think this will be a public document, but I know it's not classified. What I'm going to tell you now is that in case, God forbid, but in case there is a need for people to work from home, that all of the offices, and that I mean not only congressional offices, but offices that serve the purpose of the Capitol, will have the technology up to date in order to do that. Not everybody is in our offices is at the same level of sophistication and all of that, but to make sure everybody is good enough in case we have to work from home. We can't vote from home, however. And so it's about security. It's not about testing everybody who comes into the building. That's not realistic. But it is also hopefully that the message that goes out more globally is that people will be more responsible about their own preventative and I don't know, one thing they said the other day was, don't hug anybody who's sick, okay. Stay home if you're sick, okay. Sneeze in a tissue and throw it away, okay. Wash your hands for 20 seconds, or is it 24? Better make sure, do 24 just in case, with soap and those kinds of things. I think we're going to be developing some good habits as we go forward. But some of that sounds very basic and mundane, but it does prevent the spread. And again, the police chief gave us a presentation about what was being done to make sure that the security that protects the Capitol is secure as well. And so again, the leadership of the Capitol is always concerned about the security of the Capitol, and now it is coming down more in terms of not only security but the health security.
But nobody's changing the operations now that there's hygiene.
No, but we heard. Let me say, we heard from the Office of the Capitol Physician. We heard from the Clerk of the House. We heard from the Chief of Police. That's separate from the Sergeant at Arms in the presentations. There were some others, the architect of the Capitol and the rest, as to just logistics and under whose auspices certain things fell. But it will be ready should something come along, but what we mostly do is pray.
Speaker Pelosi,
Yes, sir. Yes, sir.
last week you said that you talked to Vice President Pence and you didn't think that he was up to the job of managing the administration's response. After meeting with him yesterday and through your experience over the last week, has your opinion on that changed at all?
Well, I don't know if I said he wasn't up to the response. I was just saying that I had concerns because of his experience in not being up to the task as governor of Indiana when it came to the HIV/AIDS challenge that he had there. I think the record is very poor there, and I'm concerned that his own director of health policy there is now the Surgeon General of the United States. Again, we're in a new setting, a new urgency, another set of scientists, some with more experience than others, in the public sector, all with some experience. And so hopefully they will listen to the scientist. As I've said, I've had confidence in Dr. Fauci. He has confidence in others. But I think we have a sufficient number of answers of "I'll get back to you" that we are continuing our vigilance.
Speaker Pelosi,
Yes, sir.
next, March 15th, FISA authorities expire. Would you, some of your members,
FISA, we said,
FISA authorities expire. Some of your members are willing to see it expire. Are you willing to see
No,
them
no,
expire?
no.
And secondly, some of your members also want to hold individuals who defied the subpoenas or the impeachment probe in contempt. Are you willing to see?
Is that two
those
different
people held in
questions? Are
contempt?
we allowing people to have two different, completely different questions, or should we move on to another person? Let me just start with FISA. You know, that's my wheelhouse, intelligence. I've been there for almost all of the FISA legislation and the rest. No, we have to have an we have to have a reauthorization of FISA. We're having our own negotiations within our own group, but also it was among the Democrats and vis-a-vis the Republicans. And as I said, we're hoping that we could be ready for something next week, but we will come to the floor when we're ready. I was very much opposed to putting a FISA bill on the coronavirus bill. I mean, really? If I have my objections to the FISA bill, as you mentioned, some do, but if I want to vote for a coronavirus supplemental, I have to vote for FISA. We're not putting people in that kind of a situation. And what was the second one?
Contempt, holding individuals in
Well,
contempt.
that's not, right now we're trying to save lives, prevent a disease from spreading. We had enough to challenge us with the with getting a supplemental that the Republicans would agree to of the size that we needed. That doesn't mean we abandon any of our responsibilities to protect and defend the Constitution of the United States, and the congressional oversight will always continue.
Madam Speaker?
Yes,
I
sir.
wonder if you have any reflections on, excuse me, this being a two-person race now. I know
He wants to talk politics under the dome of the Capitol.
who would do that?
Just as long as you don't bring up money.
We're not talking money. And Elizabeth Warren dropping out.
It says civics. Are we talking civics here?
Civics, yes.
What about it?
Do you have any reflections on your party's race being down to two people and Elizabeth Warren?
Yeah, dropping out. That was interesting, wasn't it?
Which part?
Oh, that being the last part, the Elizabeth part, that was interesting. My daughter's such an avid supporter of women that I don't know if she's going to be in a place today, my daughter Christine. But in any case, as we all are, but nonetheless, that was her focus. Here's the thing. I'm so proud to be a Democrat because to be a Democrat is to respect other opinion, including even Republican opinion. But the beautiful diversity in our caucus has always been our strength. And as I say, our diversity is our strength, but our unity is our power. And as we respect each other's point of views on some of these subjects, we have to realize that whatever differences we have are minor compared to the chasm between us and the President of the United States. So when we come together, I may have said to you before that we would madly embrace whoever the nominee of the party is. That's what I said last week. This week I say we will madly elbow bump the... we're not embracing anybody. But it's exciting, and to have a difference of opinion as to role of government and where you come down in one way or another is again the vitality, the democratic way. I hope that we won't have any, and having disagreements is otherwise only one of us needs to show up, right? If everybody was thought alike, but that we don't, and we represent our different regions, our different philosophies, our different ethnicities, all the rest, and so I'm encouraged by the debate that is taking place, that I hope will take place now with clarity of between two people. I mean, I wouldn't have objected if other people were still in the race, but to take advantage of the opportunity that's having a two-party race. But again, make no mistake, we are for the winner of the person who wins our nomination, and we respect what the public has to say about that. Yes, ma'am.
Last question.
What does Elizabeth Warren's withdrawal from this race say about the willingness of Americans and the Democratic Party to put a woman at the top of the ticket and see who be president?
I so wish every time I get introduced as the most powerful woman member, I almost cry because I'm thinking, I wish that were not true. I so wish that we had a woman president of the United States, and we came very close to doing that. A woman who was better qualified than so many people have sought that office and even won it. But I do. I think the American people are ready. I never thought we would have a woman Speaker of the House before a woman President, because if you want to talk about tradition or whatever that is, this is a marble ceiling. It's not a glass ceiling. So I always thought that would be something that the public would be much more ready for than the members of Congress. Well, and we won. So, but I think we had great candidates. They represented different points of view. Amy, more moderate and middle America, but the heartland of America, articulate spokesperson for her point of view. We're so proud of her. Also, Elizabeth, to get down to the final two who were still in the race. Elizabeth, so knowledgeable, and the rest. It's just, I don't know whether men think about being president from the day they're born and start running then. But I don't know that women do that, and maybe we should. Somebody should, but I think the American people are ready for it. It's a competition. You run and you make your pitch, and people respond to it. I do think there is. Well, it's a whole other subject for another day, but you and I do not have time for right now because I have to go to Georgetown and talk about women in power, and and how important that is. But I do think there's a certain element of misogyny that is there, and some of it isn't really mean-spirited. It just isn't their experience. Many of them will tell you they had a strong mom, they have strong sisters, they have strong daughters, but they they have their own insecurities, I guess you would say. So I think America's ready for a woman president, and I think that Kamala, I mean, all of them. How many do we have? We had Kamala and Kelsey. Tulsi. Kelsey's my scheduler. Are you running, Kelsey? Tulsi Gabbard, Kamala Harris, Williamson. We had a wide range. Of course, Amy and Elizabeth. And I think they all comported themselves very well with purpose. This is why I'm running. Knowledge, this is what I know the most about, and I have judgment on. Strategic thinking about how to get something done, and they connect it well with the American people. And now the question is, what is their political base, and how do you expand that? And just to get into the race doesn't mean you have a political base. So if there's going to be a woman president, those who might be thinking in that direction should be making decisions in favor of it rather than just going into a race because there is one.
None of those candidates are at the top of are going to be at the top of the ticket. They're not going to be president this time.
Yeah.
So when you speak in Georgetown at the Women on Women in Power,
Come on over and you will hear what I have to say.
what would you say? Why are they not going to be? Why were they rejected?
I don't think they were rejected. I think that, goodness, being a woman in all of this, when I ran for a leadership position, the worst thing I could have ever said to anybody or any of my supporters could say to anybody is, we should be for Nancy because we should have a woman. Loser proposition. Winning proposition is we should be for Nancy because she'd be the best one to do the job. So, again, what is the job? The job is President of the United States, leader of the free world, commander-in-chief, with all the authority that goes with Article 2 of the Constitution, but not all of the authority of Article 1, 2, and 3, but Article 2, and that's very big. In other countries, because they have parliamentary systems, people say, well, they had it here and they had it there. Well, they have parliamentary systems. Your party has to win, and you have to win in the party. So it's different than winning an electoral college in the United States. I don't think it's necessarily, in most cases, a fair comparison. And size as well, we're so big. But I think that those candidates, all of them, helped be trailblazers for a woman, and maybe one of them will be that person in another election several years from now, how many years from now. So I think, I see everything as an opportunity. We have an opportunity because these women put themselves out there, but an opportunity because Hillary Clinton did in such a way that was so strong, and she led the way for these women to go, and now other women will be thinking about it earlier, though, not just getting in the race, but preparing for it. And again, we have many distinguished women governors in the country, and that executive experience counts for something. And again, this you also have to people have to know you. And that's what I think is what these two candidates, people knew them best. One had run before, and Joe Biden had been vice president, and all of his credentials. That knowing people is helpful as well. So what we have to do is advance women and have standing on issues like national security, and they do. And women having standing on the economy. No, not just okay, we're going to take care of the soft issues. No, they're important and they're the strength of America, but there are other broader issues because we do believe that when women succeed, America succeeds. And that there's nothing more wholesome for the political process or a government or anything than having more women participate and be in the leadership of it. But I don't think you get a woman president by saying we should have a woman. You get a woman president saying this is the best person for the job. And any one of them could have fulfilled that description. Thank you.
Do you think women voters or do you think Democratic voters were afraid that a woman candidate would lose to President Trump?
No, I don't think so. I think anybody can beat President Trump.
Thank you.
Thank you.